Hi, everyone. I'm Blake Cadwell, co-founder and CEO at Soundly.com. I'm a hearing aid wearer, and I'm joined here today by Dr. Amy Sarow. And today we're going to be talking about tinnitus. Specifically, we'll be discussing what you can do at home to reduce your tinnitus. As you'll hear throughout this video, audiologists, ENTs, ear doctors can play an important role in your tinnitus journey, but if you're at home and you're looking for ways to get some relief, this video is really going to focus on some of your options. So, Dr. Amy, thank you for joining us. Maybe you can start with a quick overview of what tinnitus is and kind of where it stems from.
Definitely. So tinnitus is the perception of sound when there isn't anything going on in a room. You're just sitting in a quiet room and you're hearing this noise in your ear. Now, for some people, it sounds like ringing, buzzing, humming, chirping, can sound like crickets or even music. Some people describe it as electrical power line type noise. Now, there can be a lot of different causes for why somebody has tinnitus, but on its own, it is a symptom and not a disease or an illness. In the United States, there are about 50 million people who experience tinnitus. And again, that can have a variety of different causes. We know that a common cause for tinnitus is related to an underlying hearing loss. And so that's kind of what we'll be focusing more on, but there are other conditions where you can experience this symptom as well.
Yeah, thank you for that background. And if you're someone who's watching this video, there's a good chance that you or maybe someone you know is experiencing tinnitus. So let's just jump right into some of the ways that you can get relief at home. And Dr. Amy, in our research on Soundly.com, we've shared that there are kind of four big categories of tinnitus treatments that you can try at home. So there's trigger elimination, there's connected but slightly different is self-care. Then there's the whole topic of masking, which you started to talk about a bit around hearing loss. And then there's, if all else fails, there is medical treatment and the option to see a professional, which of course you can do at any stage kind of in the process. But let's break these down kind of one by one and talk about each of these strategies. So let's start with the first one, which is trigger elimination. Can you talk to us about some of the common triggers that might bring on a bout of tinnitus or make your tinnitus worse?
Definitely. There are certain dietary triggers that can exacerbate underlying tinnitus for people. And these can include things like alcohol, nicotine, caffeine, sodium. Now, with some of the dietary ones, it can be more individual. So there isn't strong research that says, this one thing will have this exact effect for everyone. But just like you can have food allergies or sensitivities, we're all a bit different in that way. You know yourself best. And so you might experiment and find out if certain foods or drinks, items had that effect for you. So certainly nicotine we know does, and alcohol does for a lot of people. But with caffeine and sodium, that can be a little bit more individual.
So let's move on to a connected but different category, which is self-care. So how can self-care play a role in tinnitus management?
It definitely can. So stress is a big factor that can make tinnitus worse for many people. So when you feel stress, it tends to sound louder. And sometimes it's easier said than done to try to reduce your stress or manage it. But there are certain ways that you can that can help. So getting good rest each night is really important. Staying well hydrated, eating good, nutritious food, taking your lunch break, maybe getting out, getting some activity in, just walking. Using mindfulness can help to try to manage your stress as well, and taking breaks throughout your day, anything like that you can do where you're caring for yourself and trying to reduce stress and take good care of yourself. That's going to help.
That's great to know. So the next category of action you can take at home is around masking. Can you explain how this works and some of the different strategies folks use to mask their tinnitus?
There are different ways that you can incorporate masking, which is essentially just using noise or sounds to help cover up the sound of your tinnitus. Now, some people like to, for example, on their phone, go to, a YouTube video or use an app, like the GN Resound app is a great one. You can experiment with different sounds. You could try white noise, pink noise, brown noise. You could use nature sounds. Those are all good. And some people find, depending on the quality of their tinnitus, certain sounds are more effective at masking the sound of the tinnitus than others may be. And you also may have certain preferences for a particular type of sound. So that's one way that you can do that, on your phone, or if you have a white noise machine, different options like that. With hearing aids, there are different ways where you can also incorporate masking noise. Now, just wearing hearing aids for someone with hearing loss can already provide a benefit, because that gives you some masking from your environment. You're hearing sounds that you wouldn't normally hear because of the hearing loss. And then we know that over time, for some people, that can help to sort of offset what's going on, because one of the mechanisms behind tinnitus is the brain is searching for a sound that it wants to hear than it did hear before. And it starts to generate its own sound to sort of offset that, hey, something's missing here. I'm going to, enter this bit of activity, so you perceive a sound now. So when you get some of that back, people do often find, as they're wearing their hearing aids regularly, it can reduce or lessen over time. And then there are also programs that can be customized for you. So that might be a white noise program or another sound that you like, where you can, access that. Or an audiologist might target a certain frequency for you, or create a certain type of a program for you that is especially effective for you individually for the sound of your tinnitus. So there's ways that you can incorporate that in hearing aids, and then, in other ways if you're not a hearing aid user.
Yeah, that's really helpful. And maybe at some point we'll do a whole video on masking, because there's clearly a lot to talk about here, but it seems like you can kind of mask in your environment with a white noise or brown noise machine. You can kind of listen to headphones and get a YouTube video or one of these kind of meditation apps. And then hearing aids really can be this kind of more holistic way of treating those missing sounds that your brain is searching for. So, if these solutions don't work, some people turn to supplements, and there are several brands online that kind of advertise different supplements that might help your tinnitus. Can you talk to us a little bit about kind of the general consensus on supplements? Do they work? And what do we know about those supplements?
So as a general blanket statement, I would say there is no one supplement where if you have tinnitus, you should take this and it's going to help. That being said, so for example, the American Academy of Otolaryngology does not recommend lipoflavonoids to help with tinnitus, because there just isn't strong evidence for their effectiveness. Now, that being said, we have mentioned that there are different reasons why you may be experiencing the symptom of tinnitus. And for some people, they have anemia, or they have, some underlying deficiency. And of course, you would want to work with your physician about, what that is, what you need to be taking. But that would be very individual. In that case, that is a supplement or something that might help to lessen the tinnitus, because it's treating one of the underlying causes that are happening there. But as I said, in general, we don't have any magic pills or supplements that we know of at this point that help with tinnitus for everyone.
Very helpful. So if someone watching this, has gone through some of these home remedies, they've tried these things, and there's still a consistent issue, or this is becoming, something that they really need more support on, going to an ENT or an audiologist is a good option. As an audiologist, I know you've talked to lots of patients who have tinnitus. Can you talk us through what an audiologist or an ENT would look for, and kind of what that appointment might look like, and how seeing a professional could help if someone is at that stage?
So in a lot of cases, if you're going into, let's say, a clinic where you have an ENT and an audiologist working together, the person would come in and have a hearing evaluation, because as I mentioned, it's probably 80 to 90% of people who are experiencing tinnitus, they have some degree of underlying hearing loss. And so we want to get an idea of, do you have hearing loss? How much do you have? Is there any asymmetry? Is one ear better than the other, which would also warrant medical investigation just to make sure there's not something else going on. So you would have a comprehensive hearing evaluation, and then the ENT would do a physical examination where he's going to talk with you about how you're doing overall in terms of your medical health and history, to look for any other signs or symptoms where we want to take a closer look, maybe do some lab testing. So as I mentioned, there you could have something like autoimmune disease, thyroid disorder, or something else going on. Now, typically somebody is going to be experiencing other symptoms along with the tinnitus. So fatigue, or, you're noticing that something doesn't feel right, or you're having other symptoms. So that's where the medical side of things would come in. And, someone else might go to their general practitioner and have a discussion with them, just to rule out anything else that might be going on. But that's what a medical evaluation would look like in an ear clinic.
Thank you. That's great to know. And so I guess just to recap for everyone, there are several things you can do at home. If you're experiencing tinnitus, you can manage those triggers or test them out, see if any of these triggers are causing problems for you. You can engage in general self-care, getting good rest, eliminating stress as much as possible, eating well, taking breaks, walking outside, exercising. You can look at masking either through a hearing aid or through, a sound machine of some sort, or maybe an app. And then, of course, you can go see a professional, and for many folks, that is the right step to take. So, Dr. Amy, thank you for this perspective. Really helpful. And for you, the viewer, we wish you the best. There's a lot of more research on soundly.com about tinnitus and other hearing related issues. And we hope you have a wonderful day.